Hi, Stefan Hartmann here, Iron Direct Primary Care with Dr. Matthew Tinney of Integrative Medicine Brevard, and we're talking about optimal reference range values of hormones. And we'll talk specifically about optimal ranges in LabCorp, for example. We'll talk about that. Maybe talk about Quest, because sometimes they're different.
Yeah,
Every lab's going to have different
yeah, a little bit. Yeah,
ways to measure these things.
but
But
they're so wide that you can find a happy overlap with
yeah,
most of them.
and there's salivary testing as well,
Yeah,
which I'll use salivary sometimes as convenient for women, because when I test hormones on women, I want them to go on day 21.
right.
But sometimes going to the lab is a hassle, especially if they have kids. So I send them a kit at home and they can do it at home by themselves.
Yeah,
I know there's different expert opinions. You go to A4M and you'll hear one lecture that say salivary hormones, the cat's meow, and the other one says you got to do blood work to be.
yeah. I think the saliva it gives you more of an assessment of where you are right at that moment, and whereas the serum is a little bit backs up a little bit. It's a little bit more of an average. Not that it's a 1 week average, but it's for the day
Yeah.
rather than for that moment.
There's this really cool salivary hormone panel, and I haven't gotten one patient to achieve it, but it's on females, and it's called the 21 day,
Oh,
master
really?
panel. And they'll collect saliva over the entire month to get kind of like an average, and also the fluctuations of
Yeah.
the cycle
Okay.
too.
That'll be interesting.
And no
Yeah.
one's been able to, it's just logistically impossible. So typically we'll
Yeah.
just send a patient to the lab. For women, day 21. For men, it's usually like a morning level you
Yeah.
get
Yeah.
drawn.
Morning
These
testosterone.
labs do fluctuate throughout the day, and for women, it's cyclical. And for men also, and women, if you have a bad night sleep, you drink alcohol, your hormones will probably be tanked the next day.
Yeah. Right.
So you can get some wacky values on
Yeah.
this.
Exactly.
So a lot of it goes into that, but we do have things we like to see. So for men, for testosterone levels, and I get a lot of these based off of young kids and optimal levels I see in younger individuals. So I'll look at these, and if the patient has a historical trend that they've had over their lifetime, this would be ideal. The ideal way to measure this would be to have a personalized reference range. So you know what you were when you were 15, 16, 17, feeling fantastic. So you have that testosterone level, and you can look at that when you're age 50, 60. Most people don't have that.
No. But I do tell guys when they are doing testosterone replacement therapy to assess where they are through the week because they usually get a dose weekly. Where do they feel best during that week? What day do they feel best on? Is it day 2 after the injection or whenever that is? And that's when I tell them to get their labs done because that's the number we want to shoot for.
Mm-hmm. Yep. So for men not on hormone replacement, and they should be healthy, I I like an optimal level between like 700 and 1,000.
Yeah.
So me and my brother, we run 1,000. We've been like 900 to 1,100, and I've seen this a couple other times in really young, healthy athletes. They're shooting a total testosterone level of about 1,000, and a free between 16 and as high as 30. I recently tested my levels, and I got a free and a LabCorp reference range of 30, which they put me in the red zone. They said I was
Yeah.
too high. And they said one time my brother's total testosterone was too high. It was 1,100. They said this was outside the reference range.
Mhm. Well, that's based on what? On other people's averages. And frankly, when you hear this stuff about hormone replacement therapy, it kind of gets a bad rap. I think maybe subconsciously people were thinking of it as somehow, performance enhancing, cheating, something like that. But really, you worry about risk that goes along with that, which is an increase in blood count, liver enzymes, estrogen, PSA, and lipids. So if you're paying attention to all that stuff, you can mitigate all those things by phlebotomy, by aromatase inhibitors for estrogen. You can do therapy for elevated cholesterols, all that sort of stuff. So the downside is really when people are overdoing it and not paying attention to those cofactors that you have to watch for other potential problems.
Yep. So when you look at the literature on testosterone, you kind of start to understand like, hey, maybe why aren't more people doing testosterone replacement therapy? We say that low testosterone, you have more risk of COVID disease, you have more risk of heart disease.
Mm-hmm.
But it doesn't seem to be very important in a lot of the mainstream medicine. Shut this door here. But why is that? Why isn't testosterone replaced more often in commercial practices?
Again, I just think it's fear of people's opinion about, oh, it's going to give me prostate cancer, it's going to cause blood clots, it's going to give me a heart attack, oh, it's going to make my hair fall out, that kind of stuff. So I think it's just really contingent on the physician to educate patients
Mhm.
and give them the choice, have them do a little bit of their own research, but don't just hands down, cast it off out of hand without really doing the research and give the patient the information they need to make an educated decision.
Yeah. Well, it takes, physician needs to educate themselves too. They need to go to the conferences like we have. They need to study.
Yeah.
The literature is out there
Yeah.
to support testosterone replacement
Oh, totally.
therapy.
Yeah. There's really only been one study that showed that that was potentially harmful, and that was done on some VA patients that already had heart disease. And so, of course, when they loaded them up with experimental doses of testosterone, some of them had a bad outcome.
Mm.
But every other study has shown that it's beneficial, even in men who have prostate cancer.
Yeah. Oh,
So,
that's Markenthaler's work. He's
yeah,
fantastic for proving that you can improve the quality of life of
yeah,
men with active malignant prostate cancer, and you don't
yeah.
expedite their death.
No, yeah, and their quality of life is significantly better.
It is. Talk a little bit about testosterone in women too. We can't forget
Yeah,
that. It's very important for women too. Libido,
yeah.
bone density, muscle mass.
Lipolysis for fat metabolism.
Correct.
Also, it lowers insulin resistance, especially when you get your levels up to around 95-ish, between
Mm.
95 and 125. Start seeing improvement in insulin resistance problems.
Fantastic. To hit those levels in women, that might seem a bit extraordinary, but some women need that, and they feel fantastic when you get
Yeah,
them in those levels.
women love
Feel
testosterone.
great. Feel great.
Yeah,
Libido increases. They feel energetic.
yeah,
It's fantastic. So yeah, total testosterone, 100 or women, I have no problem with that. Free testosterone, that varies a lot, but you might see a 2 or 4 free testosterone in women. Some men
yeah.
have
Some of
that
that
too, though.
depends on their estrogen and their
There's all sorts of methods to deliver it
yeah.
to the system. It's really patient dependent how they feel. Some feel good with one way, some feel not so good with another way. So it does take some trial and error to see what they like best.
Yeah. Mhm.
So we'll talk about estrogen, estradiol in particular, in men first. So in men, it's cardioprotective. So you don't want to crush estrogen into
Right.
nothingness,
Right.
right? And there may be some of the reasoning behind why testosterone replacement therapy decreases cardiovascular risk is because when you give them testosterone, they aromatize some testosterone to estrogen. So their estrogen goes up. And then it improves the pliability of their arteries. The arteries get a bit softer by
Yeah.
having more
More
estrogen,
compliance.
more
Yeah.
compliance. So it's cardioprotective, the estrogen for men.
It can lower your CRP for the same reason.
That too. It's anti-inflammatory.
Yeah.
So important for men, but a lot of men have too high estrogen compared to their testosterone. Their testosterone levels are maybe 300 and their estrogen is 40.
Right.
And they might start getting some gynecomastia this way. Low libido, erectile dysfunction. Maybe
Right.
they're more emotional.
Weight gain.
Weight gain.
Right.
It's very difficult for some men to break this cycle. They have high fat mass, higher adipose tissue, generates more estrogen.
Yeah. It aromatizes testosterone more easily. Yeah.
It's a difficult cycle for a lot of men to break, and they need an intervention. That's where we can make some changes for them. Now, for women, they need much higher estrogen levels. And we're talking, for young women, 100, 200, 300 levels in the blood work for estradiol.
Yeah.
They feel good.
They do. And as long as it's balanced with progesterone,
Mm-hmm.
you'll do good. I mean, estrogen causes growth. It causes the endometrial lining to grow. So you want to balance that out so as not to have problems with an estrogen-dominated cycle. You don't want to have endometriosis and
Mm-hmm.
fibrocystic breast issues, but you do have to have estrogen for your brain function to work. That's another reason why men need it. It helps your brain.
Helps the brain. It's
Yeah.
neuroprotective.
It is.
The fibrocystic breast, the poor estrogen metabolism that I've been learning is often related to a lack of iodine. And when you can give them the iodine, the breast tissue, it softens,
Mhm.
and the metabolism of the estrogen improves. A lot of women, they suffer with the low progesterone. They suffer with the
Yeah.
estrogen dominance. It's also a lack of iodine. Iodine helps improve progesterone levels. But this is a very common problem because we're exposed to so many
Yeah.
xenoestrogens.
And that's, the ones that cause the issues with excessive growth. So, and it can be anything from your shampoo to your soy products. But yeah, estrogen, too much estrogen is definitely not good. I mean,
It's quite an epidemic, is what
yeah,
I found. A lot of women deal with this issue.
yeah, and perimenopausally, I mean, typically women that are approaching menopause lose their progesterone first. So as a result, they, by nature, end up estrogen dominant.
Yeah.
And that's when women have the most trouble with hormone related illness, or tumor related illness based on estrogen levels, because they don't have that opposing progesterone. They start having issues with mood problems, sleep issues,
Sleep, progesterone,
progesterone,
critical for
right?
sleep.
Yeah, um, all kinds of other issues, bone density. But a little progesterone goes a long way in those folks, especially, regulating the timing on their cycle, all kinds of things.
And getting them to sleep again.
Yeah, getting back to sleep.
I can't tell you how many women, they can't sleep for years, and I put them on some progesterone, and suddenly they're sleeping again.
I actually, you can use the low dose of progesterone in men for sleep.
That too.
They're very sensitive to it, so you don't need more than maybe 10, 20 milligrams tops, but they do pretty well with it.
Yeah, that might some men might think that's a bit strange, but hey, if you can't
Yeah.
sleep and you've exhausted a lot of other options, a bit of progesterone.
Yeah, you wake up refreshed instead of groggy from taking a hypnotic like Restoril
No,
or
you don't
one
want
of those
that junk.
benzos.
No,
Yeah,
no,
no.
you want that junk. No. But yeah, I try to counsel a lot of my patients to avoid the xenoestrogens. It's in the perfumes and the
Yeah.
colognes. You know, you know,
Plastics, don't cook in the microwave with a plastic bowl.
plastics, drinking out of plastics,
Yeah, all that stuff.
drinking the tap water has birth control in it.
Well, just you go get one of those cases of bottled water that's been sitting out in front of 7-Eleven at 120 degrees.
Mm.
That water's going to be contaminated with plastic residue. Just been sitting there melting
Yeah.
in the sun.
I don't think anybody really should be spraying perfumes on there. There's no quality control in those. Those things are not vetted even by our FDA for all its purposes. There's no regulation with these perfume products.
Is that right? Really?
Yeah, no, you buy a perfume Gucci, you think it's something, you
Yeah.
have no idea what's in there, and it's full of xenoestrogens.
Interesting. Yeah.
Terrible. So yeah, do we talk about the estrogen progesterone ratio? So
No, not yet.
yeah, we should talk about that because that's a calculation you can do. When you have a female, you can do a calculation and you can see what the ratio is. Yeah, I like to see, ratio 100 to 250. Some say up to 500. Do you have a tighter cutoff in ratio?
Yeah, usually close to 10 parts estrogen to 1 part progesterone, somewhere there.
Yeah, makes sense. Let's talk about the other neurosteroids, adrenal steroids, DHEA and DHEAS.
Yeah, dehydroepiandrosterone.
Yeah.
It's kind of a precursor hormone. Well, first of all, this is another thing you got to understand. All of our steroid hormones come from cholesterol.
Mhm.
So this is one of the reasons why you have to have some cholesterol. You don't want your cholesterol to be rock bottom, because you won't be able to make any steroid hormones. And all of them come from the mother hormone pregnenolone. So through that pathway, you'll end up, going down a couple different directions. One of them leads to DHEA, which is the precursor to cortisol, estrogen, and testosterone. Now, nature is very interesting because push that DHEA in what direction you need it the most. So, in some respects, it's kind of a compensatory mechanism. Like 10,000 years ago, if you're in the middle of a famine, you need to have that DHEA primarily going toward cortisol to deal with the stress of the famine. On the other hand, you don't want it going toward estrogen and testosterone because the last thing you need to be doing is procreating during a famine. And so nature has a way of steering you away from procreation during prolonged periods of stress. So DHEA, it's important. That usually comes down in terms of the total number as you get older, but there's no reason to not keep it in levels as a younger adult. So
Correct.
if you're 50 and the high normal range is 160 and you're at 250, I mean, is that too high?
No.
No, because at 20, it's 450.
It's so high in teenagers.
Yeah. So, it just helps you cope with stress. Now, you'll suck a lot of that up and use it to help you deal with stressing issues. So, if you are having problems, whether it's physical stress, emotional stress, or illness, any of that kind of stuff, yeah, you probably should be taking a little bit of it.
Mm-hmm.
You know?
Also, it improves oil on the skin, is what I found.
Yeah, it helps improve the lubrication, or really just apocrine production of uh, sweat and,
Yeah.
I mean, for lack of a better term.
For me, it's too much. If I take too much, I'll get cystic acne on my back.
Yeah,
So
right.
that's a bit of a problem for me. The teenagerhood was rough for me. I bet I had high DHEA back then.
Yeah.
Acne was a bit of an issue. Too much oil on the skin.
Right.
But it can be such a game changer for an older adult with a dry skin.
Yeah, people that have Sjogren's
Yeah.
syndrome, people that have dry mouth, dry eyes, and they tell you the same thing, to take omega-3s for the same reason, because of the oil in it.
Mhm.
So
It's great. So I make sure all my patients are optimized on DHEA. Sometimes we'll put it in with a compounded medicine that we're using, where they can take it orally. It's over the counter.
yeah, it's over the counter.
Yeah.
And it comes in honestly ridiculously large doses. Nobody needs 100 milligrams a day. 25 for men and maybe 5-10 for women. If you do find in women that you're having problems with acne or testosterone levels going high, you can take it in the keto 7 form also, and that will help reduce your risk for that.
Good tip there. Now, we can also replace pregnenolone, and I see this often bottomed out in individuals with traumatic brain injury or age, which, according to a recent lecture I was on, the TBI and the age both are neuroinflammatory disorders. And so, the cognitive decline with age and the cognitive issues with the TBI have similar overlap. And pregnenolone seems to be a very important neurosteroid.
Mm-hmm. Yeah, I mean, it's the mother hormone to everything. So yeah, it goes down a pathway. In women, it helps with progesterone. DHEA will not make progesterone in women, so pregnenolone's more necessary. But yeah, if your pregnenolone levels are down, you've probably been under some stress for a while.
I will measure it and I will see it almost undetectable. So it'll read less than 15 when it's undetectable like that. And it is problematic. When you measure young, healthy adults, they're like 170, 200 on pregnenolone. So I don't think we should be bottomed out on that hormone either.
No, absolutely not.
No. And then the last hormones we'll talk about, and maybe we'll talk about cortisol too, is T3 and T4. And these are thyroid hormones, and we measure that routinely on all our thyroid panels. We don't just measure a TSH. Unfortunately, most patients don't get a T3 and T4 measured, and they only get a TSH.
Yeah, your TSH is just how happy is your brain on whatever thyroid hormone's feeding back to it. But it can be fooled. Your brain can be fooled by too high of a T4 level, which is not an active hormone. And it's called a T4 because it has 4 iodine molecules attached to it. So it's kind of built like this. When it goes out into the peripheral tissue and the enzyme systems clip off one of those iodines, it turns more into a triangle. That conformational change is what activates it to a active hormone. So now your T3 is the one really that does all the work. So that will feed back to the brain as well. But if T4 has already said, hey, we got plenty of hormone, even if you're not making a good conversion, then your T3 is going to be functionally low. Now, that conversion is based on some of these other micronutrients, your vitamin D, zinc, selenium, some of your B vitamins, iodine, your cortisol levels, all that stuff. So T3, you have to measure T3. You really to get an idea of how well a person's functioning. You just have to, and it's not uncommon to have to put people on T3 in the form of either Armour thyroid, NP thyroid, or Nature thyroid, one of those, or just add T3 to your T4 liothyronine, just by itself. But
Right.
and I've had to do that for a lot of people that just can't make that conversion properly.
Correct. Yeah. Patients will sometimes, new patients will come here and they say, "Oh, I got my labs tested at another doctor's office and it was normal. My
Yeah.
thyroid was normal." I'm like, "Well, what did they test?" And lo and behold, they tested TSH.
TSH, which is, but it's like looking through a keyhole to see what's in the room. I mean, you can't get the whole picture.
I like that. That's a good description. Tells me nothing.
Right. Yeah.
Absolutely nothing. I can't dose a medicine off of a TSH.
Right.
Unfortunately, that's standard of care in most places.
Yeah.
Let's talk about two other hormones. We're going to talk about IGF-1 and cortisol. Let's talk about IGF-1 first, because you can measure this one pretty routinely too.
Yeah.
And I'll do this with patients. If they're feeling the symptoms of low growth hormone and their IGF-1 is low, this is, anything below 130 is kind of low IGF-1 in my book. Sometimes I give them a little bit of growth hormone supplementation, either as a peptide or a growth factor supplement. They feel very good.
Yeah. Oh, yeah. Tissue repair is key. And there's really no point in measuring growth hormone levels per se, because they sort of pulse through the day. So you may or may not catch it on one of those points where it's high.
Right.
Your insulin-like growth factor, your IGF-1, is kind of an average. And they give you what's called a Z-score, which standardizes it for age and gender. They say -2 to +2 is normal. Obviously, it's good to see it in the plus range. So I agree with Stefan. In order to get that Z-score over 0, it's a lot of times necessary to kind of kick the thyroid or kick the pituitary into gear with maybe some secretagogue peptides or something along that line. If you want to take a more conservative approach, some amino acids like arginine, ornithine, citrulline, those can help. Or you can, do some intermittent fasting. Those things, sauna, yeah, cold plunge. Those things can kick up the growth hormone levels too.
They can, and also growth factors. I've been using this product is deer velvet antler extract.
Oh yeah.
You give some of that.
It's expensive. But
kind of expensive, but it hits. It's cheaper than actual HGH, like Omnitrope or Norditropin.
Yeah, that's ridiculous.
Yeah, and insurance doesn't cover that.
Well, and it makes you live longer, so I think there's an issue there. It's not any more difficult to make than insulin is. Same process, but
Really?
yet it's thousands of times more because if everybody lived to be 90 instead of an average of 81, it would probably bankrupt our system. So they basically don't want you to live to be 90.
No, man, it would be great if we could get growth hormone to everyone who needs it, but it's just too expensive. And then cortisol. Now, there are some patients, after we've optimized all the hormones, pregnenolone, testosterone, DHEA, thyroid, they're still feeling fatigue. These patients might need cortisol replacement too.
Yeah, right, exactly. And saliva cortisol testing can be very valuable, honestly. And people that have been stressed or ill for a long time, a lot of them are very burnt out. Cortisol or adrenal fatigue, which a lot of endocrinologists don't like that term, but adrenal insufficiency, let's say. And if you're going to do that, I don't like using prednisone, really. I mean, we'll want to use hydrocortisone or Cortef, bioidentical, and you don't have to do a whole bunch.
Yeah.
I mean, just a little bit goes a long way, and it definitely makes for a big difference. Because when you're talking about hormones, I mean, really your adrenals sit on top of it all. Then your thyroid, and then your sex hormones. So if you take care of just the sex hormones and you've not dealt with the thyroid or the adrenals, eventually you're going to hit a wall and you're not going to make any progress with that individual. So you really got to look upstream with cortisol. And that's one of the few that takes the longest to straighten out, frankly, if you're talking about trying to get them rebooted to make their own. So, the adrenal adaptogens are a lot of times important to start with.
So those are herbal medicine, yeah?
Yeah, they can be. There's some, there's a bunch. There's ashwagandha, rhodiola, ginseng,
Magnolia.
schisandra, cordyceps. There's a bunch.
I'll sometimes use those strategically at night who show a high cortisol at night. They can't sleep. I give them some adaptogens at night, and it calms them down a little bit, brings down the cortisol.
Yeah, there's a book that was written by a guy. Last name is Wilson, but he talks about adrenal fatigue and adrenal insufficiency, kind of some of the symptoms and how it relates through the day, because your cortisol should be highest at about 8 a.m. and lowest at about midnight. So through the day, it kind of gradually comes down. But if you're flat through the day, you're going to have a whole bunch of different symptoms than if it's high, then low, then high, then low. So, that's why it's really important to measure saliva levels through the day so you can get an idea of where to, intervene. If you're just getting an average, that really, it's not going to tell you anything.
And really, there's no other logistically feasible way to measure cortisol, right? If you're going to do a blood, you'd be spending 24 hours at the lab donating
Well,
blood.
not only that, but you're looking for a stress hormone. So, what's gonna mess you up more than anything? Let's see, I got to get up at 7 o'clock in the morning. I got to get dressed. I got to drive to the lab to be there by 8 o'clock.
No.
Oh, and then I got to get stuck by a needle.
Yeah, no.
That's going to screw your levels up. So
Yeah,
you're not going to get an accurate.
Some patients will ask for a cortisol test on the blood work, but it's kind of useless. You get a salivary.
Yeah, totally. It's the only way to accurate.
Yeah. Very good. All right, that summarizes it all. Thanks for watching.